Physician productivity I would define in terms of the physician's ability to do more, see more patients, produce more in terms of revenue for the group. There are other ways to define it, but that's one of the primary ways that we look at it. Using the SRS, our practices, physician productivity is seen mostly in their office practice. We have a group of surgeons, but in the office, particularly with the vascular and thoracic group who have the heaviest load of office patients, they can be very inefficient in terms of their own workflow, but if they're supported by staff and systems that allow them to maximize the workflow around them, then they can see more patients in a day in the office. The vascular surgeons in particular have a wide variability in terms of their own practice, but they all see north of 25 patients in a day as a matter of routine practice. Not every day of the week, but that's when they're in the office. And when they do that, it's critical, particularly for them, that the information be available and accurate. When we implemented the SRS product, we were just getting started with our vascular group, and they weren't as productive as that before. They were constantly behind in the office. Patient satisfaction was lower. We've measured that in the more recent time and benchmarked it against the prior to implementation surveys. And today our patient satisfaction is much higher, particularly with that group, and they are able to focus more on what the physicians can focus more on what they should be doing with the patient care versus focusing so much on just getting through the day, so to speak, with backups in the office. At this point, the SRS is a critical piece of seeing patients. It's a fundamental part of the business practice. If they took that away, we would have to find an option, but would consider anything really apart from a similar product to be a regression in our practice and our ability to practice efficiently. We measure kind of the efficiency of our practice a lot of times in terms of the financial piece, looking at our accounts receivable. And the part of the revenue cycle is after you submit the claim. But for us, prior to submitting the claim is where the SRS product comes in most. We measured our days to get the claim submitted at 18 days. And using the SRS product and mapping that to our workflow, we were able to reduce that to 12 days. So what that means for our practice is cash in the door versus cash sitting in preliminary stages of accounts receivable. That doesn't make more cash, but it makes the cash flow quicker. And so that's important to the practice to accelerate that revenue cycle from the point of care to the point of collection. And so we think that the SRS product has really been an enabler to help us make that piece of the revenue cycle very efficient for us.